definitely seen them. Those endless commercials promising $0 premiums, free gym memberships, you name it. Today, we're stripping away the glossy marketing to look at the hard, official facts about Medicare Advantage. Because when it comes to your healthcare, you absolutely must look before you leap. So, the big question, is Medicare Advantage actually right for you? A lot of folks get laser-focused on those immediate financial savings, and honestly, who can blame them? But they often don't realize what they might be giving up in return. Let's break down exactly how these plans operate under the hood. First off, let's get our terms straight. Medicare Advantage, which is also known as Part C, is a Medicare-approved plan, but it's run by a private insurance company. It's an alternative to original Medicare. Basically, it takes your Part A hospital insurance, your Part B medical insurance, and usually your Part D prescription drug coverage, and bundles them all into one neat little package. But the absolute key takeaway here, these plans are run by private companies that step in and take over your benefits from the federal government. The fundamental difference between the two really comes down to one word: freedom. With original Medicare, you have ultimate freedom. You can go to literally any doctor, hospital, or facility that takes Medicare anywhere in the US. No networks. None. But with a Medicare Advantage plan, you generally have to play in their sandbox. You must use doctors and providers who are in the plan's specific network. If you go out of network for something non-emergency, your plan might just flat out refuse to cover it, or you're going to be paying significantly more out of pocket.
Okay, so why do so many people sign up for this? Well, the immediate appeal is totally undeniable. Original Medicare doesn't have a cap on what you pay out of pocket every year unless you buy a separate supplemental policy. Medicare Advantage plans actually have a hard yearly limit on those costs. Plus, like we said, you might get a $0 monthly premium, though keep in mind you do still pay your standard Part B premium. Add in those bundled extra perks that original Medicare just doesn't touch, things like vision, hearing, dental, fitness programs, and yeah, it sounds like a fantastic deal on the surface.
But here is the catch, and it's a big one. To get those lower upfront costs and those shiny extra perks, you are fundamentally giving up control of your medical care. You are allowing a private insurance company to step in and manage and, let's be real, sometimes restrict how, when, and where you get your health care. It is absolutely less expensive month to month, but the ultimate compromise is surrendering the control and the stability of your plan, both right now and in future years. So it is absolutely crucial to understand exactly how you're giving up that control. First, like we talked about, you're locked into a network. Second, depending on the plan, like if it's an HMO, you might be forced to get a referral from your primary care doctor every single time you need to see a specialist. Just extra hoops to jump through. And third, these private companies have the power to demand approvals before you even get care, which means ultimately they have the power to deny treatments or deny specific providers if they decide it's unnecessary or just too expensive. And that brings us to a really critical term you'll see all over the Medicare handbook: prior authorization. Basically, this means you or your doctor has to literally ask the insurance company for permission before they'll cover certain services, supplies, or prescriptions. With original Medicare, if a service is medically necessary, you rarely need prior approval. But with Medicare Advantage, your doctor has to plead their case to the insurance company. And if the plan says no, you either don't get the treatment or you're paying for the whole shebang out of your own pocket. Now, here's something you really need to think about. What happens to your coverage as the years go by? When you're 65 and healthy, staying in network or dealing with a prior authorization might not seem like a huge deal. But flash forward. What happens when you're 75 or 85? Your medical needs suddenly get really complicated, and you need a top-tier specialist. Is the plan you lock into today going to give you the stability you actually need tomorrow? Listen to this. This is a direct quote from page 62 of the official Government Medicare and You Handbook. Your plan can also change the providers in the network anytime during the year. Think about that. Your favorite cardiologist, that primary care doctor you've been seeing for a decade, they could just be dropped from the network right in the middle of the year. And if that happens, the handbook says you usually can't even change your plan until the next enrollment period. You just have to pick a new doctor from their approved list. That right there is a massive loss of stability. The rules, the out-of-pocket costs, the extra benefits, and those all-important provider networks in a Medicare Advantage plan, they can, and they very often do, change every single year. So that compromise for the lower premium today means you're giving up the security of knowing what your healthcare will look like down the road. You are basically dealing with a moving target. Because of all this volatility, if you're even thinking about choosing one of these plans, you have to do some serious homework. You can't just wing it. Here is your mandatory pre-enrollment checklist.
Before you sign on the dotted line, you must verify that every single doctor and hospital you use is actually in the plan's current network. You have to verify that your specific medications are going to be affordable. And you need to make sure the treatments you rely on will actually get approved without making you jump through a million hoops.
And honestly, medication verification, it's a maze. You can't just ask, hey, do you cover my pill? You have to check if your drugs are on the plan's exact formulary, which is their specific list of covered drugs. You need to find out what tier they are, because higher tiers mean you pay way more out of pocket. Oh, and you have to watch out for sneaky rules like step therapy, where the plan literally forces you to try a cheaper drug and prove it doesn't work before they'll pay for the one your doctor originally prescribed. Or quantity limits, which cap how much medicine you can even get at once. When you step back, it all boils down to this one major trade-off: short-term savings versus long-term medical freedom. Are those limits on your yearly out-of-pocket costs and that free gym membership today really worth surrendering your freedom to choose your doctor tomorrow? Are they worth handing over the control of your medical approvals to a private insurance corporation? This is exactly why the golden rule of Medicare enrollment is this: never jump in blindly. Ever. You absolutely must verify that everything you use insurance for is going to be approved. And you need to confirm that there honestly aren't any other more cost-effective options out there for your specific medical needs. Because let me tell you, trying to reverse a bad healthcare decision later on when you're sick, it can be incredibly difficult, sometimes even impossible.
The stakes are just too high, and the rules change far too often. That is exactly why it is absolutely critical to talk to a licensed health insurance advisor to navigate all your options before you enroll. The documentation from Stevens & Associates Insurance Agency really highlights this. A licensed advisor can actually look at your specific doctors, your exact prescriptions, and your unique financial situation to help you decode all that fine print hidden inside these private plans.
Ultimately, as you're sitting there looking at those glossy brochures and weighing those $0 premium promises against the harsh reality of restricted networks and prior authorizations, you really have to ask yourself one final question. Who is actually in control of your healthcare future? Is it you and your trusted doctor, or is it a private insurance company? Take the time, do your research, and ensure that the choice you make today is truly going to protect your health tomorrow.